Oh, good for you. Awesome.
Okay, then we are set.
Okay, are you all set?
Where to look?
Yep.
I know.
I know.
All right. Does anybody have any issues seeing what I'm doing?
Nope, we can see all your slides.
All right. I'm getting this funny security notice. Okay, can you see that?
Vision and learning.
Uh-huh.
Yep.
All right. I'm assuming that some of you all have heard of developmental optometry. Am I correct?
Yep.
Yes.
Okay. Some people are very, very surprised that we're over 100 years old. There's been a lot of information about us over the years. We are a specialty within optometry, so I am an optometrist, but I have specialized in this for over 40 years. Absolutely love what I do, and I like talking to preschool teachers. Believe it or not, we have a lot of similarities in what we do, and I'm sure that many of you have seen this slide before. People in a 3D movie watching. Did you know about 20% of the population cannot use both eyes? 15 to 20%. And if I had a show of hands there'd probably one or two who cannot. That has to do with the two eyes not working as a unit. The two eyes working together is a major part of development. So because of my developmental background and because of what you do, I want to be really clear about what to be aware of when you're working with kids, kinds of issues that show up developmentally. I believe I have a very unique background because I did a year fellowship at a place called Gazelle Institute of Child Development. It was a full year fellowship. Arnold Gazelle, G-E-S-E-L-L, you got to Google him sometime, was the first to come up with normal developmental milestones back in the 1920s, 30s, 40s, a little bit in the 50s. He had always had a very tight relationship with developmental optometry, to the chagrin of ophthalmology. For those who may not know, ophthalmology is they are the MDs who do eye care, but they absolutely have no background in what we do. So we're quite different in many respects. I want to talk first of all what I mean about vision. Vision isn't 20/20. It's only a small part of it. But yet, when all of you have had exams, I'm sure that you have the major piece of it was to make sure that you do have 20/20. Your eyes are healthy. If you don't have 20/20, then you have glasses or contacts, what have you. But vision is very different than that. We use the term quite differently. Much the same as you'd use auditory acuity, what you can hear, versus the whole processing piece. So vision is really understanding what we're looking at. It's reading traffic. It's a child accurately judging how far away a ball is, for example. It's about understanding the environment. And it really is about cognition. It's about problem solving. And if you haven't looked at what you do in those terms, I would politely suggest that you do, because all of your effort really is to improve cognition with people in the age group that you're working with. The other part about vision is it's massive. Can you guys follow me?
Yep.
Yes.
All right. So it's about 80% of all that we take in. It's huge. It's a huge part of what we do. So when there are glitches, when there are issues with the visual system, it causes there's almost a one-to-one correspondence to behavior. The visual system is so large that it dictates in many respects behavior. And we know in the classroom that 80% of learning, you might have heard that percentage before, really depends on the visual system. And again, it's not acuity. In fact, if children come in to see me, or adults, and they have issues with clarity, and I were to prescribe glasses for clarity only, it would have zero impact on the particular issues going on. So it doesn't, it's not meaningful in terms of a clinical help. We also know that, as from what I said earlier, that vision is foundational for thinking. We all think in terms of visual imagery or visualization. I want to talk about this with kids in a minute, but this is a very important concept. It has to do with imaging, with visualization, visual imagery, all that is vision. This individual, stealing from what she, or just quoting her, actually, what she, in one of her books, that spatial thinking and perception of space and movement through space is really foundational for all thought. And vision deficits are cognition deficits. Perhaps all of you have heard of the back of the eye called retinas. Retinas are actually brain tissue. So when you're focusing with your eyes, you're actually focusing with brain, which I think is kind of cool. Now, this is where we get into what very much applies to what you're doing in your day-to-day work. Acquiring a functional visual system is a developmental process. It's not a eye color. It's not a size of a foot. It's totally different. It depends on the activity that the individual does that it improves its functioning. And I want to talk about, everybody with me right now?
Yep.
Yeah, I'm not. It's like I'm speaking into a box because I really can't see people, but we're good as long as you can.
Hey, Todd, are you seeing this room anymore? Are you seeing that empty table we did?
I am, but you guys are way off in the distance there, so I'm not really seeing any particular detail.
Can you do me a favor? Can you stop sharing the screen for a second? Can I?
Sure.
Change the camera so you can see.
Okay.
Okay.
Let me do that.
Thanks.
Yeah. Stop share. There we go.
All right. Let me see if I can get.
Now I got a great view of Cindy Hutchins. That's good. Cindy, what do you do?
Muted. I'm a director of a preschool, but I happen to be home right now, so that's why I'm zooming in. So.
Oh, nice. Yeah, I'm home. As you can tell, I'm in my office at home. So, yeah, nice.
I'm home playing grandparent rather than
Oh, are you?
preschool director. So
Yeah.
either way, it's a
Nice.
good thing.
Nice.
All right. I'm gonna keep. I don't know why it's not letting me see what. I can try and switch the camera, but you won't. You'll have to tell me when you see us because I can't see anything. So, are you seeing us yet?
I got turned the other way. I did for a second, but you guys are still in the distance. I have no problem continuing as I am.
Okay.
Yeah, I don't want to. I want to communicate, and if there's questions, I need people to stop me or whatever to make sure I'm getting these concepts across.
So you're.
I think they're really
not
important.
seeing us at all.
You can see us in a tiny bit under him
Oh,
over
can you?
here.
Oh, I'm okay. So the
Yeah,
screen. I'm looking.
There's like
all
a
right.
screen over
All
there.
right. There's a different screen than that.
Yeah.
Yeah.
I'm impressed.
Where are you seeing that? Oh, there. Okay.
Yeah.
All right.
Now, if you rotate it there, there you are. It's like I'm looking down at you from the second floor.
Yep. Okay.
Excellent.
Now you can see us. All right. Let's go back to sharing the screen.
Let's do it. Okay.
I haven't quite seen it.
We're very impressed with you. So.
I don't know why we're just.
Okay, here we are.
All right. Thank you, Todd.
Yo, thank you, Claire. Okay. By the way, this person is a pediatrician. She's written a lot about vision. She gets it very clearly, and she's written a lot about autism. If anybody has a particular special interest in that area. I must say that we have 4 offices around Northern Virginia, and probably about 20% of our patient load is on the spectrum. The very, I'll talk about that in a few minutes, why that is. So let me talk about sequences, developmental sequences. You probably know that almost every movement system in the body has its own sweet timetable when things roll out. And this is one that's really critical. And this has to do with movement. And movement in a person starts with what are called primitive reflexes. And if you've never heard of those before, I would encourage you to Google them and take a look at them, because they're a very important part of early development. Let me explain. When we're born, the only way we can move is reflexively. In other words, something has to be done to us in order to move. So a very common one that people know is if you lift a baby on their back, they'll suck in air, called a startle reflex. If you rub the side of their hand or foot, their toes or fingers will curl. There's many reflexes. They're very dominant in the first year of life, and we override them in time. There's different terminology for that. Some say integration, but we override them in time, so they're in the background. They're not dominating. Issue is that because of lack of movement these days with this population, we see a lot of kids with retained early reflexes. Now, so what? What does that have to do with life? Well, during the first year or two of life, the primitive reflexes diminish, but at the same time, big muscle control begins to fully develop, and it develops all the way in a normal functioning person, all the way to age 5, 5.5, age 6, somewhere in that area where a person can finally ride a bicycle. We call that bilaterality. It has to do with both sides of the body that integrating. And I'll bring up this point, I hope, multiple times, that in the age group you're working with, cognitive development isn't from learning letters. You can express intelligence through the language. However, developing thought, developing problem-solving ability is through gross motor activity and fine motor, but we'll talk about that more as we go. So primitive reflexes give way to gross motor. That fully develops around 5.5, 6, somewhere in the area. And then oculomotor skills are called, you can put them into a category called fine motor control. So eyes, speech, hands, other areas, fine motor go under the rubric, the fine motor control, don't develop until we have a great foundation of gross motor ability, of movement ability. Does that make sense?
Okay.
And also, we want those primitive reflexes to be able to diminish, that they aren't influencing, because if they influence, they cause a lot of problems. For example, a kid is not tracking well, always has retained primitive reflexes. We can work on improving tracking, but we don't develop it fully until the reflexes are dealt with. That's something we do in our clinics. So let me move on. The next, here's a book, a fantastic book. I love the title.
Hey, Todd, we're just seeing all the little slides as opposed to a big slide.
I'm sorry?
We're seeing like your panel of like 10 slides across.
Really? Huh, I'm on a slideshow? I don't know what happened here.
Might have to stop share, start the slideshow, and then go to share again.
Thank you, whoever is up on all that technology.
It's our youthful director. Just figuring out every meeting she comes into play.
Glad to bring something to the table.
All right, I'll have to use one that it seems like I'm limited with this. This will work. Are we good?
That's better.
Yeah.
Okay. So, all right. Although my it's not moving the way I want it to. Okay. So, here's in the publication called Dyslexia. This is a few years ago. There was an article about reflexes causing issues with reading difficulties, And also Piaget wrote about reflexes. They're not new, but the understanding of them and the therapy of reflexes is fairly new. Here's another developmental sequence I want to talk about. I talked about motor movement to be really critical, which it is, but this one I think is it holds the same weight as the previous one. That is, when I mentioned that vision has to do with thinking, that it has to do with cognition, that we use visual imagery to problem solve, that this sequence is really critical for that. And it'll explain a lot to what you see with kids. So when we put something in our mouth as an infant or a toddler, we're actually seeing, we're abstracting that concrete, whatever it is in our mouth, we're actually seeing it in our mind. That's how blind people see. Contact with skin produces an image. This is such an important piece of being human, that it has that early developmental component to it. We then go to hands, which I know all of you know that hands are huge learning tools for manipulation and so on, and understanding the environment. When we hold something, again, we're visualizing what the heck we're holding. Does that make sense? Okay. Is that everybody? Do you follow me?
Yeah.
Okay, thank you. So about 6 or so, I should be able to look at something like a coffee cup. 6.5, that's when this change occurs, where I know what it is. I don't have to put my hands on it to support what I'm seeing. So when I have a 10-year-old who comes in and their hands are all over my equipment, they're holding things, I don't think, oh, that's ADHD. What I do think is that's a smart kid, but they're using a very inappropriate way of seeing. So they're still using hands to pull in information. The other part is that, the other part of this I want to talk about briefly is that the kid who comes in and they're not hands-on at all. They may do action toys, they may set up different scenery, but they don't use their hands to manipulate. That kid's in trouble. There's a problem with that. And if you have kids like that, really important to emphasize the hands through a lot of different activities. So this is a major developmental sequence that we think about frequently. To support that, oral stimulation is important for calming and other things, but also it's for visualization. Not uncommon, you'll have a child who had a lot of things in the mouth, it went through a period like that early on, stopped it, and then is doing it again. That's when you're going backwards in development because there's something going on stressful, either in the family or with the child themselves. There's issues going on where they're reverting back to a lower developmental piece. This is just a brief slide here that cognition, motor development depends on visual processing and fine motor control, eye-hand control. So in our testing sequence, we look at this very, very carefully. I'll just touch on this briefly. There were 7,752 kids who were tested, pairs of twins, and they did what's called a draw man test. It's a very old test, actually, and it was developed at Gazelle Institute years ago, interestingly. But it's a way of gauging development in children. And the point is that the higher drawing skills, later on, there were higher IQ scores. So hands-on is really important for cognitive development. There's many other, there's a lot of support out there for that. Here's another one, that our body positioning sense, or where we are in space, is a developmental piece. And this is critical. A lot of kids don't know where they are in space. Some of those kids, because of other reasons, are on the spectrum. Some are not, but many kids are very unaware of where they are in space. Another way of saying it is their brain doesn't quite know where their body is. In that situation, you can count on high levels of anxiety. That's a kid who doesn't like to climb. I can give you lots and lots of examples of this, but it is an issue. And it leads, when this is done proper, when the sequence is undergone properly, then depth perception is the pinnacle. Do clumsy kids have visual deficits? In our clinical experience, 100% do. It's not 80, it's not 90, it's 100%. Now you guys can appreciate this. This has been a real problem in our culture. I'm sure all of you would agree. Lack of movement leads to lots of issues. Does anybody know what the average is nationally on a device for a child these days?
Yeah.
Do you?
Oh, wait, how many hours or the age of the kid?
No, average for kids, I suppose up to age 18. What do you think?
Oh,
Any clue?
4 hours.
No, 3 times more. Look it up. It's awful. Very high. Now here's our friend Arnold Gozell. He was at Yale. He was there for years. Developed a clinic, a developmental optometry clinic within his area. And I was a fellow there, years later. But this book actually is still published. Vision is Development in Infant and Child. Okay, vision's a key to a child's development. Why? Because it's such a huge processor. If there's visual issues, it's impacting development. Another way of saying it. And what causes these? Developmental history is a big one. Birth history is also huge. That's where there's issues around birth. Many complications can be part of that process, which will cause issues down the road. And also medical history, of course, with any kind of injury. Ear infections can cause problems down the road. Another one is the long-term comprehensive near work, including devices, where people are on devices for long periods. The impact of these vision problems are literally life-altering. They change people's perception. This is something, I don't know where all of you are with this, but I can say developmentally, the more hands-on, the more opportunity for coordinated movement, the better. And way back when in the 50s, when I went through kindergarten, it was all movement. And we now know there's a field, in fact, called embodied cognition. It's in the field of psychology that looks at development of thinking patterns based on early childhood development. So we know that a kid's smarts will be helped by learning how to climb, for example, or throwing a ball, or jumping, whatever. All that is important. Yay or nay? Does this ring a bell with you guys?
We're all on board that.
Yep.
Say what?
We're all on board.
That's what I thought. This is another area that there has been a lot of pushback recently, and I don't want to go into it, the lack of time, but there is an issue within vision care called convergence insufficiency. It's where the two eyes don't work together very well. It can happen at a very young age, but you have very poor attention span. If a kid can't fixate, many of them can't, who are developmentally behind, they can't fixate, they have very poor attention. It's just part of what I referred to earlier with how important the visual system is. If they can't target their eyes, they're going to have issues with attention span, period. And it's really overlooked. There are other things that can cause attention issues, such as not enough vitamin D. There's many other areas. This guy, Richard Saul, is pushing to have physicians do more and more blood sampling, more testing, because there's many factors that will cause attention issues. He's trying to get rid of the whole term. So in his book, of course, he does medicate, but at a much lower rate. But his point is, let's start looking at what are the sources of this, because it's always comorbid. Let me move on. there's an article a few years ago on the relationship of of this business of the two eyes not working well together and ADHD. They found a threefold increase in ADHD. Dyslexia has many visual components. I could talk about this for 3 hours. We actually have a person within our office system who works with people with decoding issues. There's many cool aspects of this. Dyslexia is usually in kids with high spatial IQ, kids who are very bright with figuring things out. But again, that's a whole other piece that I'm not going to get into now. But we see a lot of people with these issues. Does vision therapy cure dyslexia? Heck no. No, it's a language issue. But with dyslexia, there's always eye movement problems. Kids skip lines. Also, trying to decode drains what I call the brain battery. They can't hang in very long. They get very ornery, quick, or very upset. Autism also is another piece where vision plays a big role. In fact, there's newer research that's saying that it's a visual deficit that is causing these other issues. It's one way of looking at it. I think there's many other reasons. Let's talk about this. These are common visual signs in early childhood. What's the youngest that you see children? Does anybody go down to this age level?
Under 1.
Oh, you have under 1?
No.
Oh, 1.
Yes?
1 year old.
To 1, okay. So crossing eyes could be a problem. They aren't exploring with hands. And they don't have a firm type of grip when they're reaching out. Now, reaching out for an infant is similar to your eyes landing on a target. Okay, when you do this, when the child manipulates, it's the same system as the focus system within the brain. So the focus system, we think in terms of clarity, but its purpose really is to understand. It's the understanding part or the cognitive part of the visual system. And in early childhood, it's the reaching and the hands that will tell you an awful lot of information as to how well the child is processing information. 18 months, I'm making a little bit of a leap here, but they'll bump into things. Vision always guides movement. Always guides movement. That's something you can hang your hat on. And when it's not, it's interfering. Okay. Other signs of issues they'll mouth things, they'll sniff objects. They're still using this area to learn about what they're holding. When they're looking at something, they tend to move their body. They haven't freed up eyes and head and body at this point. They're unable to stack cubes, and a vertical line is the first one that they should be doing at this age, and they can't. Age 3 to 5 years, poor tracking. They can't fixate very well when you're talking to them. They can't walk and observe something at the same time. I would think that right now you're playing through some kids who you've seen with these issues, and they can't copy a circle at 3 and cross at 4 and a triangle at 5. A triangle at 5.5 is well, a triangle, it should emerge about 5.5. There's a couple of copying tests that we do in the office, and one of them has been around for many years. That been a huge help for us, called a VMI, visual motor integration. Poor orientation, car sick often. Kids who hate transitions, they don't do well with that. You have to tell them ahead of time. That's very commonly a child who has very poor understanding of where their body is in space. We call it a vision vestibular dysfunction. The eyes and the inner ear are not integrating as well as they should. There's problems with that. Now, what do we do? We'll use prisms. That's a very important piece of what we do. We'll at times use bifocals if necessary. And that's cute, Cindy. They do look like regular glasses, but we have been using these for years and years. We call them therapeutic prisms. They can make a big difference. They help with toe walking, kids that can't coordinate their gait going up and down stairs, and all of them tend to have very thin skin. They don't handle stress real well. The other area that we use, the big part of our practice is called vision therapy. And years ago, there was the language of let's go ahead and give it a shot and see how things work out. Today, when we recommend vision training, we know what we're going to get. It's not an if. If there are issues along the way, typically there was compliance issues, or there's very significant problems going on. There's other issues going on as well. But it's a highly effective process that we use. One thing about ophthalmology, I would think that all of you or most of you have had some experience with this piece where the child goes to a pediatrician sends them on to ophthalmology, they have eye surgery. Just know that in those cases for crossed eyes or eyes that turn out, that it's very common to have more than 2, sometimes 3, sometimes 4, sometimes 5 surgeries. Afterwards, the 2 eyes working together is not the goal. The 2 eyes looking like they are okay, are working together is the goal. It's called a cosmetic outcome. And as you know, that in development, in learning, that feedback is huge. If I don't throw the ball in the hole, the feedback I'm getting through the visual system will help me correct that. And that's through a major part of that. It's called proprioception or proprioceptive fibers that are in muscle. And when the eye muscles are cut, those fibers are gone. So you can tell I'm not a real fan of strabismus surgery. At the very bottom, Dr. Sue Berry had 3 of them at Yale when she was a kid. In her 40s, she went through vision therapy, saw 3D for the first time, and her journey is well documented. She does a lot of speaking now. She has a lot of clout. But she does a lot of speaking to different medical groups and telling them that you need to be careful of surgeries for this particular problem. There's a lot of issues. I want to bring up this book that she wrote. I think you'd find it fascinating. And I know my time is short with y'all, so I do thank you for your undivided attention. And I am going to honor questions that you have. What I just did was very brief, but I hope it gave you some food for thought.
So it looks like you have an office in Springfield.
We do. We've had one for a while there.
Where's Lansdowne? Is that Maryland?
Sounds out near Leesburg.
Okay.
I have a question. What should, as like school systems working with young children, is there anything or any specific activities that we should just be doing with all children to like work on this? Or this is something that like really, once it's identified as a problem, needs to just see like a specialist sort of immediately?
Good question. Now you're talking about private school systems. Public school system, there's very little desire, I would say, unless you have an individual teacher. Are you talking about private?
Yeah, I mean, we all work with like preschoolers and below, so like around that age group that we could be doing, yeah, we all have the ability to implement our own practices more or less.
Okay, so good question. So as I said, immersing in hands-on, which I think would be status quo for what you do. Am I correct?
Yeah.
Yeah.
That there's a lot of opportunity for different kinds of whole body movement. Am I correct?
Yeah.
jumping, climbing, et cetera, walking on a walk rail. Let me say it this way, that when you're working with big muscle, when you're working with what's called the bilateral systems, both sides of the trunk, you're also working on developing fine motor control of speech and eyes. So if an adult comes in to see me and they have, let's say their left eye turns inward a little bit, it'll show up on that side of the body as well, as we call it the weak side. So when they sit, they'll be more on the right, or when they talk to people, they'll angle their head. So it becomes really a half body kind of issue. So any kind of bilateral activity is huge help with the visual system. Also,
Can you unshare your screen? Because then we can see you.
okay. Okay. Let's do that. Let me unshare. And hopefully I can see you. Can you see me now?
I can see, now this is where I'm gonna, you keep talking, I'm gonna have to play here and get, we're just seeing Cindy, so don't worry about me, just keep talking.
Well, I just want to answer questions.
We can keep asking.
Keep asking.
Here we go. We see you now. Can you give us an example of just some of the activities you do in the office?
Oh gosh.
I mean, like
Oh yeah. I mean, there are many. I mean, we work heavily on developing 3D. Poor 3D is a very common issue with kids in development. The 3D people think of as depth perception, which enables you to park a car between two spots, which enables you to catch a ball and so on. All that's true. It's helpful for distance judgment, but the more critical piece of it is a cognitive element. So when there's binocular issues, that interferes with thinking patterns. So so we do a lot of activity through different kinds of equipment to develop that piece. There's many pieces of that, because one of the things with kids, we've known this for years, is that you've got to engage them. What we do is highly neurological. It's no different than speech therapy, where there has to be novelty to it so the kids buy in. Same thing with your teaching, right? I mean, you have to be able to buy in with certain activities, and then repetition plays hold of that feedback, as I said. And what you're really working on is called neuroplasticity, and that's been well published. That you're developing new pathways in the brain, or you're hooking up older connections that stop connecting. So, did I answer your question? We also work heavily with what are called prisms. They're very thick prisms where a child will do an activity, and the prisms are such where they really have to feel their body. If I put them on one of you, you would, if you're walking, you'd walk sideways about 15-20 degrees, and you'd be heavy on this side of your body, and you see the floor tilt. Believe it or not, there are a lot of kids who don't see that. They don't feel that. They don't see that. Their proprioceptive ability is very low. Thus, their learning ability is very low. So this proprioceptive feedback part of the brain is huge for learning. So much of what we do is based on that. We also do a lot of spinning. We know now that the playground equipment way back when was developmentally sound. So a merry-go-round was helpful for primarily for attention span, but also for balance. It has to do with stimulating eyes and inner ear, so that there's better control of the body.
Ever since I got prisms in my glasses, I'm not afraid of heights anymore, because now I know why I was afraid of heights. I don't think I was.
Yeah, I mean, we see a lot of adults who come in and they don't realize they have double vision in the distance, because the body's been the brain has been masking that, and they can't drive at night where they feel very they lack confidence. Or a child who comes in, same issue, where they have some doubling going on far away with it, but the child doesn't make any note of that, and they will never get in the middle of a pack in a soccer game to go after the ball because they lack confidence. So an appropriately functioning visual system increases confidence with people out there in space, out there in movement through space.
Oh, good.
So I have, first of all, you explained my son to me, which just thank you. He
So
was,
tell me more about the guy.
so, always kind of a squirrely kid. I kind of knew he was gonna get labeled and it always really bothered me.
I know, it's unfair.
When he was 10, he was complaining of headaches in school, and I was 10 when I got glasses. So I just took him to my optometrist, and I could tell something wasn't quite right away because the doctor was doing all kinds of tests with my son that he never did with me before. So then he says to me, "So good news, Mom, your son has 20/20 vision. Bad news is he has strabismus. He's basically, cross-eyed and has no depth perception." So then the doctor and I are talking back and forth, and after a minute, my son interrupts and says, wait, you mean when I look at my hand and see two hands, that's not normal? And I'm like, Mom of the Year over here, and I'm a professional.
Yeah, but it's hard to hear that because you would think you'd be on top of all that, but what you're describing is most common, by the way.
But it was so, I guess, mild, just
Right.
looking at him, you didn't see it.
Right. And that's believe it or not, that's the hardest strabismus.
Exactly. That's the hardest because I learned that his brain was always confused and didn't know which eye to pay attention to.
Yeah.
So then my doctor sends me down the hall to, I think, a developmental optometrist, but maybe not, maybe just good with kids. And he talks me through it and it's great. And we get prisms and my son does like exercises with red and green lines on cards.
Yeah.
And I think it helped him for sure, but then that also explains why he was sort of, I have issues with the ADHD diagnosis as well. Like, I'm gonna get that guy's book, but I feel like the vision stuff maybe played more of a role in that than I realized at the time. My son is very successful right now, by the way. He's got a very, big job that he in the Army that he's good at. And so he found
Was he an Intel?
Hard. The actual, sitting in classrooms and doing that kind of schoolwork was always hard. But once he was doing more hands-on and once the work became more meaningful and he could understand behind it, then he just jumped all over it and is doing well now. But
I want to piggyback on that.
Sure. And then I have a question.
Okay, I want to piggyback on that. So we look very heavily at multiple intelligence theory. Now, it's been shot down by a lot of academics, but it holds very well out on the street.
Yep.
Okay, so we look especially at the hookup between academic intelligence, which is linguistic, which is reading, writing, and spelling, and spatial IQ, which is a whole different banana. Spatial IQ isn't tested for at all in schools. But spatial IQ is huge. In my mind, it's probably the most intelligent type of thinking. So you need that for architecture, you need that for engineering. And that's the area where the linguistic tends to be suppressed. Einstein had horrific dyslexia. That's where we find the dyslexics, people who have high spatial IQ. They articulate very well at a young age. They can do that because speech depends on the richness of the visual imagery. It depends on that. So so many of these kids go through school and they feel like they're stupid because they aren't able to do the reading and writing and spelling business. Majority of the blue collar people out there who are gifted with AC and heat, with electrical and so on, hardly got out of high school and they hate to read. But yet they have these huge spatial IQs, which isn't tested for in SATs, by the way.
Right. No, I'm with you 100%.
Yeah, in fact, out in California, if you ever look at spatial IQ and do a little background, it's pretty nifty. There was a crew that identified, so they thought the smartest guys in California, smartest high school kids in California, tracked them for 20 years. They missed two guys who got the Nobel Prize in physics because their SATs were depressed with literature and they're depressed with the word problems. So they scored poorly with SATs, but they went on. And so a way of testing spatial IQ is looking at like a simple origami. where you fold something into three different, you know what I'm talking about?
Yeah.
You look at a piece of paper flat and you fold it this way. Does it look like A, B, or C, or D? That's spatial IQ, where you take it and you rotate the object in your mind.
Yes.
So there's a cool linkage. Also, if you have high spatial and you have low gross motor, that's where you get the red hot emotional issues at age 3, age 4, age 5, age 6, early gassing on fire reactions to things. Many times they come in and they're already under mental health care. We don't, we love the book, The Body Keeps the Score. Are you familiar with that?
No.
It just says that many behaviors through childhood are physiological. It's not a mental health issue. It's physiological.
That was my question for you. So
Yeah.
I often try to reassure parents and have to remind teachers that sometimes when we see an issue with a child, it could be physiological.
Right.
And so let's start there.
Yeah.
Okay? So my question for you is, let's say we've got a friend who it could be ASD, it could be ADHD, whatever, any of those things you've mentioned.
Yeah.
Okay. Let's say we want to start thinking differently. So let's say we want to recommend them or refer them to you. How would that process work? I mean, I get overwhelmed.
Well, the first thing is that they go through a pretty lengthy triage call. So they're on the phone for about 20-30 minutes. They
Okay.
and half the time there's lots of tears on the parents' part.
Oh,
Because the people who are doing the triage are former therapists with us who have moved out of state and they're able to do online work for us part-time. So we have several people who do that. If the person still is very insecure about coming in, they think the doctor might have 3 heads, then we do a screening. Once they come in and I'm able to connect behavior with what I'm seeing visually, then the parents will move boulders to try to get something done. And many of these parents come in, they've already spent $50,000, $60,000, $70,000. You already know, I know you know that. They've already spent a boatload of money trying to solve these issues.
Well, that is part of my question that came up, and I think you said the same thing. Like, so we're all pretty small preschools, and I know my school does like speech screenings. It's kind of the first entry level of how to help these parents as they're processing what's going on with their children. So is that a possibility? Is there a screening that's a more simple screening that could be implemented on a general basis that helps you start seeing those red flags or certain indicators that a child might be?
Well, honestly, we used to have screening mornings once a month, and it was mayhem. It would be like 4 hours, and we had lots of juice and cookies and coffee and so on, and people went to different stations. We did that over the years, but frankly, it was a very inefficient system. The way we do it now is that they come in and I will see them for a free screening, the problem with that is that the doctors in our office are behind 2 or 3 months in terms of getting in. Come in for a screening, then you have to get back in line for 2 or 3 months before having a regular exam. So the triage will help people to gain confidence with what we do. Really, it's many people that don't know what we do, but that's not true of much of the population. Anyway, so they help guide them in that process. I do have screenings. I probably see 2 a week, one or 2 a week. Does that answer your question?
Well,
You're saying how can we get the word out, or how can we?
well, and can
generalize?
I ask a question? What about what the Prevention of Blindness Society does? Are you familiar with that?
Sure.
Is it worthwhile based on, I mean, they used to, have you guys done them?
Yeah.
So, they used to have the kids do something with, I don't remember, something about fish cutouts. Now it's a little box and they just like take a picture of the kid's eyes. And I don't know what that's, I think.
Well, let me explain that. It's a very, very cool instrument, but it's screening 2 things. It's screening for an eye turn, and it's screening for what's called amblyopia or lazy eye, where one eye doesn't see very well, the other one does, and you can't tell when you look at the kid, they have a problem going on. So it screens for those two conditions, but those are only 1 to 2 to 3% of the population. It's a very small amount that have that issue. The things that we see, especially in a learning disability population, are the amount of visual problems are very, very high.
I guess what we're trying to get at is like, who should we be referring to get these services in a way that we're not overwhelming what seems like a pretty small subset of you who do this work? Like, what should we be looking for? What's that key red flag that's like, yeah, I think they would definitely benefit from this, as opposed to like, obviously we're not trained.
Yeah.
I
So
don't know.
avoiding here's in a nutshell: avoiding hands,
Yeah.
balance coordination issues, poor attention span. And as you know, if there's significant issues going on at home, all bets are off. You know, and so that's a different kind of thing. But you know that.
So at what age? So like a 3-year-old, honestly, they're falling half the time, and that might not be quite as alarming.
Correct. Yes. Excellent. But they should be able to look at you. They should be able to hold attention on you.
Well, so here's like my issue with, we're not specialists. And like, I often tell my teachers, we are often just planting the seeds to help these families with what their child is developmentally where they are. Often, I mean, we get really excited when a family engages and wants to immediately get testing or go that way, but often it's a seed that's planted. And planting those seeds, what is really helpful if you have either a checklist and say, you know, I mean, or either a screening, because we're not the specialists, but we can say, look, this is what we're seeing in the classroom, and here's our checklist, or here is our the $40 speech screening that comes in. And so if you want to take that and go somewhere else, here are the specialists that will help you with a more intensive.
Yeah, yes, everything you're saying is absolutely true. But I think that the one thing that is not being said is you don't want to look like you're referring.
Well, but you have to have, we're not specialists, so there has to be some type of
Criterion.
or something that we as educators could say, okay, here, just like we do the developmental milestones, or we have a speech screening come in or OT screening come in, and then we say, okay, either it's through a grant, we can pay for it, or either we have it for our school, and here's the results, and that helps plant the seed or either start the process of them.
Yeah. This is a big issue. I mean, you're really hitting the tip of the iceberg. I mean, I diligently 15 years ago went around to all the Lions Club in the area, say, hey, you guys are out there screening in the schools. When you see these issues, they need to be sent on to somebody else, not to regular optometrists and ophthalmologists. Well, we can't do that. We can't discriminate. Well, if they have a retinal problem, you always send to ophthalmology, right? You know, I mean, there is some thought as to where to send people. I spoke to the regional Lions Club, but I completely stopped because it was like a wall. These people do great work. It's not that. It's just that there's nothing in their system that allows that, really.
Well, you know, what I think I've gotten out of this is I have one teacher who diagnoses developmental eye stuff all the time. I mean, she's like, she's like, that kid needs to go to the eye doctor. She's like really good at it. I think it's behavioral and stuff that she sees, or the way they're just not looking right. But to me, I'm getting from this, and I'm so excited you were at Gazelle and then you have multiple intelligence, because I'm all over that. Is that when we have a really difficult kid, maybe we should just say, hey,
Exactly.
instead of jumping right to ADHD,
Exactly.
let's go see the eye guy first.
Yes.
Well, and what you'll get frequently is, well, they I already checked the eyes. The kid has 20/20. So then you have to explain there's different ways.
We can,
What?
it said now we're better informed.
Right. Right, but you'll get that a lot. Yeah, I mean, they've already done, and then the parent doesn't do what you ask, and but your job is done. I mean, that's it.
Then we
Yeah.
planted the seed, yeah.
And I guess also in any literature, so for example, my son does have dyslexia and it was a whole new world for me when I was learning about it. And there's some great resources that
Yeah.
have, like, here are some, because it can look so different in so many kids, but here are a lot of things to look for. And if you're reading this and it kind of seems like your child in some way or another, then you should keep on this process. And a lot of the things like I would never have known before that, like tying your shoes and things like that. So is there a source in this arena that is a really good handout or
Yeah.
information to say, and
Yeah.
this- like when we see that, like
Yeah, Claire, let's you and I work on that, okay?
Oh, yeah, okay, yep. And Christy, are you on?
Say what?
I'm talking to one of my teachers who's on. Hey, Christy, are you there? I see her on here, yeah.
Oh.
Okay, my OT is on, but she must not be able to open up right now. So I wanted to see if she had any questions, so.
By the work, I work heavily with OTs.
Hey, Christy, you're there?
Hi, yes, I just, sorry, had to get over. I was in the middle of cooking something actually. But yeah, no, I think all the information has been really helpful. I think, it would be helpful to have like a little checklist or something that we can say, you're showing enough of these behavioral issues or physical issues that it warrants maybe seeing a developmental optometrist for an exam. I know, my kids have also gone, they used to see Dr. Reinierson before she retired. And it's really helpful. As you're saying, so many of these things are integrated and have an effect on something else. And it's hard to tease apart, like, what is, sensory, what is just vision. I mean, it's usually all of those things are being impacted. So I've appreciated all the things you've said, and it's been a good reminder for me because it's been a while since I've
And Christy,
been able to hear it.
and what do you do in life?
I'm an occupational therapist. So I'm at the preschool. I'm at Westminster Weekday Preschool with Carolyn.
really?
And yes,
So they
Yeah,
hire
yeah.
an OT. That's awesome.
yes. So I get to run a lot of
Well, you
fine
guys
motor,
are
most motor groups.
you're miles ahead. I mean, all the stuff I'm telling you is we probably did you know that our specialty started about the same time as yours did?
Oh, I did not know that.
Yeah, the early 1900s. And did you know I spoke at the State Association in Stanton this year for pediatric OTs?
Oh, no, that's great.
Where were you?
Well, yeah. I haven't attended a lot of those conferences lately.
Oh, yeah. Yeah.
Yes, I think that's all great. I first heard about it when I was working at the Lab School of Washington. And I saw Dr. Reinierson speak there. So
Good. Okay. So I think, Christy, I think you're a great resource. I mean, you're looking at fixation patterns with eyes. You're looking at balance issues. You're looking at eyes and hands very carefully. I know you are.
yeah, no, absolutely.
So when there's issues in there, I'd filter it through Christy. I mean, and by the way, you guys can always call me if there's an issue. Please give me a call. If there's something I can, if I can at least pass on something, be happy to do that.
You're here because of the Tuies.
Right.
Raving about you. They have one of their sons is just, he struggled with so many of these transitions and upset, and they were just thrilled to get to you, and you helped them feel like, oh, maybe there's some answers.
Yeah.
Right. That's why you're here talking to us.
Right. Yes.
Well, anybody else?
Yeah, thank you.
So much.
Hey, thank you all. And Claire, it is Claire, right?
Carolyn. If you're seeing Claire, it's okay. You're seeing Claire's name because she's one of our other directors that's zooming in. But it's Carolyn.
All right, Carolyn, let me get that checklist to you, but you are So smart to have an OT on board.
And she is amazing.
Well, we refer a lot of young kids to OT first. So, you know, for a lot of reasons. So anyway, God bless, guys. Thank you so much for
Thank
hearing this.
you.
Thank you.
Bye-bye.
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 So who else?